Its move some advocates have long sought as a way to improve access to life-saving drug, but its definitive impact won't be immediately obvious. Take a look at the related issues. What is Narcan? The approved nasal spray from Gaithersburg, Maryland-based Emergent BioSolutions is the best-known form of naloxone. It can reverse an overdose of opioids, including street drugs like heroin and fentanyl, and prescription versions including oxycodone. Making naloxone more widely available is seen as a key strategy to contain the nationwide overdose crisis, which has been linked to more than 100,000 U.S. deaths a year. Many of these deaths are due to opioids, primarily potent synthetic versions that can take multiple doses of naloxone to reverse it, such as fentanyl. The drugs were distributed to police and other first responders across the country. Advocates believe it is important to give naloxone to people who are most likely overdose, including people who use drugs and their relatives. Ingoglia, of National Council on Mental Health, said in a statement that the decision represents a determined, practical and humane approach to helping people and flattening curve of overdose. What does FDA approval mean? The company said Narcan will be available over-counter by the end of summer. Other brands of naloxone and injectable forms are not yet available over-the-counter, but they may be available soon. A few manufacturers of generic naloxone made similar Narcan will now have to file an application to replace their drugs without a prescription as part of a requirement from the FDA. Reduction Therapeutics Inc., non-profit that receives funding from OxyContin manufacturer Purdue Pharma, has a pre-FDA application to distribute its spray version of naloxone without prescription. How is naloxone distributed now? Even before the FDA's action, pharmacies could sell naloxone without a prescription because authorities in each state allowed it. However, not every pharmacy carries this. And buyers have to pay for the drug either with an insurance copayment or for the full retail price. The cost varies, but 2 doses of Narcan are usually around $50. Although drugs are not easily accessible to everyone who needs them, they are also distributed by community organizations that serve drug users. Emergent has not disclosed its price, and if is available without a prescription, it is not yet clear whether insurance companies will continue to cover as a prescription drug. In a statement, FDA Commissioner Robert Califf encouraged Emergent to offer the drug at an affordable price. Does preparing naloxone on the store improve access? It paves the way for the availability of Narcan in non-pharmacies, for example in grocery stores, supermarkets and online retailers. Jose Benitez, Chief Executive of Prevention Point Philadelphia, an organization that seeks to reduce risk for people who use drugs through services, including distributing free naloxone, said the service can be very helpful for people who are not seeking or living where it is not available. Now, he said, some people are concerned about buying naloxone in pharmacies because their insurers will know they're getting it. Putting it on the shelves will allow people to just buy it without stamping it, he said. However, it is not yet clear how many stores will carry it and what the prices will be. The U.S. Centers for Medicare and Medicaid Services, which currently includes prescription naloxone for people in state insurance programs, says over-the-counter naloxone coverage will depend on the insurance program. The centers have not given any official guidance. Doe-Simkins, co-director of the Remedy AllianceFor The People, which was launched last year, provide low-cost, and sometimes free, naloxone to community organizations, said his group will continue to distribute injectable naloxone. Are there disadvantages to over-the-counter sales? Keith Humphreys, an addiction specialist at Stanford University, said one of the concerns is whether people who buy Narcan without a prescription will know how to use it properly, but the manufacturer is responsible for clear instructions and online videos on this topic. He said one benefit of getting pharmacists involved is that they can show buyers how to use the drug. An important thing to remind people: call an ambulance for the person taking naloxone after it's administered. He also said that if the drug isn't profitable as an over-the-counter option, there are fears that the drug maker may stop producing it. Geoff Mulvihill, Associated Press.